Hey, so the other day I posted that it's important to ask questions to your hospice representative when you're considering hospice. So today I just wanted to come with some questions to ask. And if you want more questions, please follow us on YouTube at hospicenurse and review that video. But here are some examples of things you should definitely ask when you're interviewing with a hospice company for yourself or for a loved one. One would be, what is expected from me as a caregiver and from the patient? I think sometimes hospices will come in and just say, oh, we can do this and that and this and that, and forget to say what the patient is still responsible for. So as a patient or as a caregiver, that's a great question to ask. Another topic that I think should be reviewed when you meet with a hospice representative is being transparent on how you feel. What is going on? Is it pain, nausea, depression? Do you have wounds? And then not only that, but ask them, how can they help you with this? And just make sure that what they say is also aligned with your goals and you feel comfortable with the symptom management. Another question to ask is, how does your agency handle emergency situations? And one thing to look at with that is maybe bring up an emergency that you and your family have gone through, something that was traumatic for you. Give them that example and see how they would have helped you with that if you were on hospice care. I think that gives you a good understanding of how they can provide care for you. And again, it kind of gives you an idea of if it aligns with how you feel and your goals. Another question to ask is, are there any limitations when it comes to your care or with you being on certain medications or receiving certain treatments? If there's something out there that you still want to be able to do, have that conversation with your hospice representative to see if it's aligned with the hospice philosophy, or do you need to consider something maybe like palliative care? And then I think a common question that patients would like to ask is, what type of support or resources could you give my family if my care becomes too much for them? I know most patients do not want to feel like a burden on their family at all. So I will definitely encourage you to ask the hospice representative how they could support you and your family as your care increases. So I would ask, what services does your agency provide? Now, all hospices are regulated by Medicare, so there are some things that they have to follow. But there are some hospices that offer more services like pet therapy, massage therapy, birthday recognitions, veteran recognitions, just things like that. Another question to ask is, how often will someone from hospice make a visit? Or how often does the nurse come by? The chaplain, the social worker, your bath aide, how often do you see these individuals? Ideally, you and your hospice representative or hospice nurse will come up with a schedule that you both agree on, which is very important. We're coming into your home, so we don't want to just come in and take over. We want to still respect your privacy. So speak to your hospice nurse or hospice team member about coming up with a schedule that works for them, but most importantly, it works for you. It's also important to ask what happens to your family doctor or your specialist. Some hospices will allow you to still see those physicians, and I know some others that will not let you see the specialist at least, but you may still continue to see your family doctor. Every hospice is different. Another great question to ask is if there's anything that hospice does not cover that I am still responsible for. And this could mean lots of things. I've had patients who thought we were going to provide like clothes, which that's fine, but that's not something that hospice can do. But I've been asked that question before. But what I mean by this mainly is medications, toiletries, any type of supplies, medical equipment. Find out what your hospice is able to provide and anything that you are still responsible for as the patient or caregiver. And with that, ask about if there's any limitations or treatments that you can continue to take. Another great question to ask is, what happens if I decide that I no longer want hospice? Because that could happen. Or what happens if I no longer qualify for hospice? How would that look? You know, we have patients who, what we call graduate. They come off hospice because they no longer meet qualifications. You may also want to ask, is there any out-of-pocket cost? Now, typically there's not. If you're under the Medicare benefit, there is no out-of-pocket cost for hospice. Under different benefits or other medical insurance policies, there could be. You may also think about asking if you have to be homebound. That's typically something we see in home health, but you never know with hospice. You should also ask, will you have the same team members? Having consistency is so important. I do know, I've heard patients say, I had 7 nurses or something like that, you know, but they've seen a lot of different people. But make sure, or if that's something that's important to you rather, ask, will you have the same team? Of course, we know when people go on vacations, they may have the backup nurse come or their replacement, but usually you have the same people. Now, for some patients, it's important for them not to pass away at home. They want to be at home the whole time while they're receiving care, but once they're getting to the end of life, their goal is to go somewhere else to pass away. So if that is your goal, please talk to the hospice representative about them being able to accommodate that for you. For my company, if that's a patient's goal or wish, we will contract with the local hospice care facility and provide transportation for the patient. Ask the hospice representative what support is offered to the family once you pass away. After I pass, what type of support will you all provide? Medicare has a benefit called bereavement, where the hospice team, hospice company, will continue to make contact with the patient's family for 13 months after their passing. And if you need it longer, that's always an option. But some hospices may do a little more. They may offer more after the patient passes away. So I think that's a good question to ask as well. So the number one question to ask if you are considering hospice for yourself, if you're a caregiver or considering hospice for a loved one, is actually a question to ask yourself, not a question to ask the hospice representative. But that question is, what does quality of life mean to me? And that is something I really want you to think about. Maybe before you even meet with the hospice team, what is something that you value? What is something that, despite this illness, I still need this in my life? Another example could be, which is something that I hear often, is no matter what, I want to be at home. Do not take me to a nursing home. Do not put me in a facility. I want to be in my own home. And as a hospice nurse, that is also going to be my goal, because that is the purpose here, that this is the goal, to ensure that you have a great quality of life as you endure this terminal illness. For some people, it could be having my family around. I met people who want to be able to play cards on Thursdays. I'm going to do whatever I can to assist you and provide support to your caregiver so that we can make sure that your quality of life values are carried out. So this is something I really, really want you to think about. When you meet with that hospice representative, be prepared to say what you need. You know, they want to come in and say what they can provide. You need to speak up as well, be an advocate. I hope this video was helpful, but you can use this if you're a patient, caregiver, or if you're a hospice representative. Use these questions to help you with your informational visits. See you guys in the next video.